everyone. Welcome to the second episode of Designing for Health and Wellness. In our first episode, Margit and Leah talked a bit about their personal and professional association and journey with the cannabis plant. And today we're going to be talking about medical cannabis patient experience versus the recreational adult use experience. In our final episode, we'll focus on the ideal experience for the future of medical cannabis patients. So my name's Georgie. I'm Georgie Gordon of GBG and Associates, and we are a marketing firm near Palm Springs in the Coachella Valley. And I'd like to welcome Margit Whitlock, who is the principal of Architectural Concepts. And she's a architect who is licensed in lots of states. I can't list them all, but a lot of them. And she does everything from conceptual development, brand development, custom furnishing, art programming, purchasing, and she's a sought after architect for the resort and hospitality industries and for retail businesses and the cannabis industry. And during this three-part series, she shared her personal association with the medical cannabis plant, and she's going to be offering some very concrete information about designing for health and wellness in this particular episode. And after Margit, we're going to be talking with Dr. Leah Johnson, as we did last time. She's a doctor of pharmacy, and she worked with patients and healthcare providers from all over the country to reduce the amount of medications they're taking, alter the timing when they're taking them, and the dosing of medications to improve effectiveness. And she also identifies medications which could be causing issues. She works with cannabis companies to advise them about dosing and safety and interactions and how to better help their customers see health improvements with the use of their products. So today we're going to start with Dr. Leah. And last time, Leah, we talked about the challenges facing medical cannabis patients. What are the options available to patients seeking to incorporate medical cannabis into their treatment plan? Is there in-home care, online visits, house calls? Do they walk into a dispensary with a prescription? How does that work?
So it all depends on the state, but at least in the state of California, this is a big area that we are actively working on as healthcare professionals who are in the practice. In many states, they actually have healthcare professionals, specifically pharmacists at dispensaries. So that way patients do actually bring in their prescriptions along with all the information that the pharmacist would need to review to make a decision. Sadly, in the state of California, it's gone completely commercialized. It is really only focused on rec, even though technically dispensaries are approved for both rec and medicinal. So it's important to understand that when you go to a dispensary, legally, they're not allowed to give more information than this product has this in it. And they can explain what other customers have bought for different reasons that the customer has explained, but they are not legally allowed to give any medical advice. So, so the best thing you can do is it's again, in California, it's a bit tough, but tracking down a medical cannabis professional. The biggest places you want to avoid are the ones that are card rec places. Sadly, half of the providers don't even understand how to utilize cannabis. All they do is write a card and say, oh, here you go. Good luck. You need somebody that's actually going to work with you hand in hand, who's actually going to look at the labs that you bring them and the meds that you're taking and make a decision on if that's usable for you or not and what dosages to use. So again, like the biggest thing to do is really look for the people that say that they consult with patients. The other thing that, especially in the state of California, what I always say to patients, you have to be very careful for are people that call themselves cannabis coaches. Not that every cannabis coach is an issue. I always warn though, the problem sometimes with cannabis coaches is their knowledge is solely in cannabis. They have no knowledge about other medications. They have no knowledge about other pharmaceuticals. So they don't know, or other herbal supplements, and they don't know about bloods or labs or how to read avoid that type of material. So again, there are plenty of really great cannabis coaches who have actually gone to medical, for example, people who have gone to the Maryland School of University of Maryland School of Pharmacy program to get their master's in medical cannabis science and therapeutics. They are not healthcare professionals, some of the people graduating, but they do have the education to know how to utilize them therapeutically. So at the end of the day, I mean, if you're going to go to a cannabis coach, make sure you know what degrees or what certifications they have, specifically a degree if they're not a healthcare professional. If they are a healthcare professional, make sure that they have worked with patients and that they actively work hand in hand with patients. So that's the biggest thing, is finding somebody specifically working in cannabis and not somebody who either writes cards or is a coach. You need somebody with both the degree, and you need them to also have the ability to where they actually actively work with the patient.
Dr. Leah, what kind of ailments do most patients present with when they come into a dispensary, or vice versa when they talk to you? What kind of things do they think that cannabis might be able to help them with?
So I see the gamut. It's really great, actually. Most of my patients are usually at their wits' end. So they're just—
That doesn't sound so great.
I mean, it's great because of the fact that a lot of patients are very hesitant to do things until they're at their wits' end. When they're at their wits' end, they're willing to say, okay, I'm willing to understand my doctor might not be having me on the right meds. Beforehand, they're like, but my doctor, I'm sure he or she is educated. I'm sure they know what they're doing, I think. At their wits' end means that they're like, you know what? I'm in your hands. Let's work together. Let's do this. And it's not that way we want to break down the patient before they get to me, but it's very good to be at the point where they're willing to try anything. They're an open book. And so I get a lot of patients. The most typical, most common are pain, anxiety, and insomnia. Those are the big three. That's most people come in with those. Autism is a huge one. It's getting more and more prevalent, especially when we learned that many autistic patients, especially the lower functioning autistic patients, are known actually to have a dysfunction where they're actually not making anandamide. And anandamide is our version of THC. It's our endocannabinoid we make. And so what they find is, through studies, they've actually shown that people that have autism spectrum disorder, most of them are actually either underproducing or not producing anandamide at all. So they really benefit from the utilization of cannabis therapy, both CBD and THC. And then I even also help patients. A lot of patients come to me to get off meds, to get off seizure meds, to get off even blood pressure meds, even sometimes diabetic medication, depending on what level. Again, it depends on the level, depends on the dose, it depends on where their level of ailment is. But I've been able to wean people off of anti-seizure meds. I've weaned people off of anti-blood pressure medication or blood pressure medication. And it's really great because really the point of cannabis is just a homeostasis. It's not really supposed to bring you up or bring you down. It's just supposed to level you off. And so when utilizing it, it makes the other areas of the body work better. So when those areas are signaling better and working better, then the whole body goes back into a happy homeostasis. And then often you can reduce some of the pharmaceuticals you're using.
How does a patient know how or when cannabis should come into their treatment plan? How does the patient know that?
So it depends on the practitioner. As a practitioner and as a pharmacist, I personally like herbals to come first. And the reason is because herbals are, especially full spectrum herbals, and herbal products that are standardized. And the reason is because when you go to the pharmaceutical, you end up getting isolates. Most pharmaceutical products are isolates of a certain, like hydrocodone is an isolate of hydrocodone. It's a molecule that is made to be a derivative of the morphine plant of morphine or opium. So it is And the reason why people are getting side effects is because, not saying that you can't get side effects from the opium plant, but the opium plant, as being a plant, it's going to have protective entities. It's going to have the protectiveness that cannabis has. It's those polyphenols that are in it that actually protect the plant. So again, you're still going to, obviously, I'm not saying go out there, smoke opium, definitely not saying that whatsoever. Just saying that when an herbal plant is taken into the lab, it is shrunk down to its one molecule that's beneficial. And then all those other beneficial entities in the plant are just stripped away. So it's the same thing with cannabis. We've seen it even in pharmaceuticals when cannabis is brought to the pharmaceutical companies and stripped down to just THC or just CBD or both, specifically Epidiolex. I like using that one because that's CBD. It's flat out CBD. It's an isolate of CBD. But the problem is that a lot of patients, based on the dose that they have to use for patients to help prevent seizures, some patients do have liver issues that they get from the product. And we don't see as many of those negative side effects when we're using the whole plant full spectrum. So that's why it's just so hard to know, where to start, because of the fact that, when it comes to these products, it's you really want to make sure that it's a whole plant, full spectrum product.
That you brought up a good point, that you said we don't know where to begin sometimes. When a patient goes into a dispensary, since we're really talking about partially the physical layout of the dispensary and the mood of the dispensary or clinic, where do they go for the right information? Let's say I've got something kind of wrong with me and I really think that maybe cannabis would help, but I don't really know. What would I do when I walked into a dispensary?
That's the hard part. I usually recommend to people that if you have an active ailment, do not bring it to a dispensary. Get that knowledge found. You go to a dispensary. It's similarly to you get diagnosed by a doctor, you go to the pharmacy to pick up your medication and to learn about what the medication has in it. I say it's the same thing when it comes to dispensaries. You get the knowledge from your cannabis practitioner. And I really actively encourage to go to a cannabis practitioner that's going to work with you on your meds, because the dispensary level in the state of California does not have healthcare professionals able to legally give proper information about health.
Do you know, I'm not sure if you know, but in other states, are there healthcare professionals on site?
Yep. Oh, yeah. So sadly, in the state of California, the Board of Pharmacy is not involved in cannabis care, even though it is a medicine. It is completely run by the Department of Cannabis Control. So really, pharmacists are not involved here. But in states like Connecticut, it's enforced that every dispensary has to have a medical cannabis pharmacist on site. The same thing for New York dispensaries. They have to have a medical cannabis pharmacist on site. So that way and it's similar. And there's many states with it. Pennsylvania is another one, but it's up to the state regulation board to make those decisions. And when California came out, they did not insist that a medical professional was on site. And because of that, the companies took over and it's become completely commercialized, where at this point in the state of California, dispensaries in general, whether they're medical or recreational, 100% commercial. There is no medical professional there to educate you, except for the one or two dispensaries that are willing to pay the cost to have a medical cannabis professional there. But again, those are leaps. There's maybe one or two that I know of in the entire state that actually has that, because when a dispensary is not enforced to have a medical professional, they don't want to pay to have that medical professional there.
So this leads us to you, Margit, because knowing that this is the problem, particularly in California, even though other states have been dealing with it in different ways. But from your experience, Margit, how can a dispensary design include both medical patients and adult use consumers?
Well, I think that it has to be a very clear distinction on your merchandising. I mean, much like a regular pharmacy, there's an area for anxiety or sleep or pain, here's the aspirin, here's your foot cream, so if there could be some way for somebody to kind of associate themselves quickly with a certain area, that these are the products that would help them for that, issue that they're having, I think that would be very helpful. And so consumers can then be steered in the right direction. And, right off the bat, they're not confused. They're not walking around going, what do I do? What do I do? What do I do? What do I do? And also I think that having product literature is important, and recommending dosing instructions could be important. I know that they're not allowed to, but there could be a learning center, like your cannabis store dispensary could also be a learning experience. So, maybe there's a computer station with tutorials available, or a viewing room, or a listening station. We have to help educate people. So if you're really committed to this flower and the plant, then I think we have to give it a little more thought, and not just, it's not just another liquor store on the corner. It's people have to spend time, educate, help, and just bring about some better awareness on what to do. And I think that we also need to help regulators in the state change their minds about some of this. So they're allowing people to have the cannabis professional in-house. It doesn't have to be like 100% on across the board, the whole state, maybe, because that'd be a little tough for California. But you did. It is an appointment, it's a clinic. It's an appointment center. You come in with your intake form, you fill it out, you come up with a plan, you monitor. So how does that fit into the typical dispensary? It doesn't at this time in California.
So what components would you incorporate into like a patient area or consultation area to enhance the patient experience and aid healing?
So as Dr. Leah and I talked, previously, is that consultation is probably one of the very first steps. They're going to have your outside professional. If you have a cannabis coach or a cannabis professional, you're going to come into the dispensary. And because you can't have an actual prescription, you're going to come in and say, this is what the kinds of things my doctor has recommended. Can we talk? So what do you have? You have a one-on-one. And not all people are coming in as a one-on-one. They're probably going to bring a friend or a loved one with them, because, they're not very, it might be unsure, So, so let's make it comfortable. Let's make it, it could be either a room of its own, comfortable chairs, a table, a monitor, some literature to go over, an iPad, however you're going to take that. Or it could be an alcove. It could be a smaller section in and around, but away from the retail area that's busy and bustling and noisy and distracting, right? So we want to give people a chance to discuss their problems and issues, because these are personal, and let them have a little space to do so with a cannabis professional. So Dr. Lee, you can pipe in here. So, you've got your vibe, your cannabis vibe, and this is really about your brand position. So if you're a hip youngster vibe, this might be your look, and that might really work for you. Does it work for the cannabis medical consumer? Most likely not.
And it actually makes it kind of hard too, because there are some younger people, like, the younger population, which you would think would, fall into this realm, and they're afraid to go to something that's a little bit more medicinally kind of looking, because they're like, but this is obvious, I don't fit in there. I fit in here. And it's like, but at the end of the day, patients need to go where patients are getting their proper feedback. And these places would be fine. But as you're saying, they need a consultation area with a healthcare professional that they can either have on call or make appointments with. So that way, if this fits in for that, millennial who really wants it, or Gen Z who wants to go to a place like this and they feel more comfortable, then they at least need to have an area so that they can still feel like a patient when they need their medication.
Right. And I was reading up online about the difference between, medicinal versus, adult use. And they were really saying that the space needed to be more like a clinic, which I disagree with. I think that I don't need to be treated like sick. Okay. I need to have, a decent environment, whether I want this kind of environment or I want this kind of environment, which is the jewelry box idea. Basically just went to Nordstrom's and picked out some diamond earrings. So, but these are really cool too. But I think that what we were talking about is that if we're going to have a consultation room, it needs to be comfortable and it needs to have some privacy.
Absolutely. Absolutely. So yeah, and then as you can see here in the consultation, you can see that this allows, as Margit said, it allows a great quiet area. So that way, I mean, a lot of these patients have ailments that are going to make them break down when they talk about them. They have very painful situations, whether it's actual pain or emotional pain. And the last thing you want to do is be in a dispensary with a bunch of people joking around about what they're going to buy and how they're going to party with it, when you need to talk to somebody about, how your cancer is affecting your life and everything. So it is so important to make sure you do get those special private rooms, and to make sure, and they could have glass, they could be see-through, but you need to make sure the patient is feeling comfortable and feeling like they can tell you everything, because the last thing you want is for them to withhold anything and have that be something that can cause a problem or interaction with the cannabis without knowing it.
Totally agree that the environment is very important. We don't need to be treated like we're, in the ER, let's say, like this little bottom one. It's not this, pretty much. It's not this. Somewhere far above that, hopefully, from a design aspect.
Oh, I see it. Yeah, I see it less like a clinic, more like actually a therapist's office, more like a psychological therapist. Like you go in, you're gonna nice comfy couches, box of tissues on the counter, and somebody that is a medical, is a cannabis professional that can then work with you on dosing and everything needed. Absolutely.
So Margit, I know you put together an overall checklist too of features to maybe consider building into a dispensary to make it a positive experience for both patients and adult use consumers.
So this is just one of many, many, many things to think about, but I just wanted to make a quick overview on kind of like the 5 things you really need to do in the process. And really it's the process of from the time you enter the property, honestly, create that sense of arrival, from the parking area to the lobby and reception, make it safe, clean, ADA accessible, very clear signage, and it has to be well lit. So you have to feel safe. It's just like going to anything else. I mean, this is not a new concept here, right? So it's the same, making a consumer feel comfortable in arriving. When you get there, I think you need to provide some entry seating to rest, because if you are treating or catering to the medical cannabis consumer, they may need to rest. They might have a little trek from the parking lot to your door and be winded, right? So they may have a little rest, sit down, wait. There might be a waiting time, because that will also give some time for your occupancy levels to be kind of regulated across the way, so you don't have too many people in the dispensary at one time. And if they have to fill out any kind of paperwork or sign some release forms or something, they need a little space inside to do that first. And then have very clear signage on where the medical products are, if they are separated from the adult use products. And be very strategic about your merchandising. Like I said earlier, these are the sleep aids, and these are the pain aids, and these are anxiety aids. And maybe even then provide, the consultation room or an alcove, what we talked about already, where you can talk about product options. And this is definitely more needed for medical patients than adult rec patients, obviously. And then, provide an environment that feels inviting and comfortable and secure. And for me, proper lighting, because every retail design is a science when it comes to lighting. So don't skip out on maybe a lighting designer to really highlight path of travel, identify certain highlighted features of either art, wall, architecture, interior architecture, and product itself. It's all very different when it comes to lighting. But overall, as you build your brand, remember your target market and your brand strategy, and you're going to create that vibe. So what is the vibe that works is very important, and you have to follow through with that kind of brand promise throughout the whole experience, from the parking lot to the checkout stand, and even the follow-up email or any other, digital marketing you might do pre and post. It has to all be in that brand promise. So that's just a whole nother business consulting thing to do. But that's a quick 5 things to think about. And there's many more other things to think about, but just a snapshot.
Thank you for that snapshot. And I'm sure that if people write to you, that you would be able to send that to them too.
Oh, sure. I can send that.
Okay. Well, Leah, do you have anything to add to this particular session before we move on to our next session in a few days?
No, I was just going to say, no, I totally agree with Margit. Like I agree with all those concepts. I think that's exactly what we need. And especially, I actually kind of love that you put a place to sit, because everybody seems to forget that. They just, there's one dispensary, it's actually Synchronicity Holistic in Carmel, because I've been there multiple times, and it's literally, you walk in and there are seats right there before you even talk to somebody and give them your ID, just because they know that even though it's a short distance, there might be people that need to have a little bit of a break. Then there's the front person to speak to, like, I don't want to say concierge, but there's the like the check-in person, and they take your ID, and then you can sit back down, or if you need to speak to somebody, then they put you into the waiting room. So I totally agree with you about the sitting. It's just something I personally never would have thought of, because obviously I'm not a design person, but it's just brilliant. Like, it's actually so simple, but actually so needed. And people don't even think about it, because I've seen people lines out of a dispensary. Where are all the patients going? Where are they sitting? A lot of patients just can't stand for that half hour in that line.
Yeah, totally. There's kind of the generation 1 dispensary, there was always a secured lobby with a security guard and a bulletproof glass and a secret door you had to go through. Things have kind of changed a little bit, but there was that waiting room, which really now needs to be transformed into a lobby, right? From a hospitality standpoint. And then you move forward, like you said, check in or wait, or maybe your buddy's going to meet you there and you just have to sit and wait for them, or your mom is coming because you're going to help her, or there needs to be some space to, kind of just chill out, hang out, and then you move on. Because also I was talking about occupancy. You don't want your dispensary so crowded that it's chaos, right? And there's a lot of product around, and just, so they really should control the occupancy in and out very, methodically. And so there definitely needs to be a place to sit. Even outdoor seating would be great too. It doesn't have to all be indoors. You can sit outside too.
That's a great idea. Well, thank you, ladies. This is going very well, and I know that everybody's getting a lot out of it. I know that I am, for sure. And I hope that everybody will join us for our next episode, Designing for Health and Wellness, when we look at how design can contribute to health, wellness, and healing. So we'll be looking at all those aspects next time. And if you've got questions in the meantime, please reach out to one of us, Margit at 4designs.com, Dr. Leah at Alchemist Cannabis Consulting.com, or me, Georgie, at gbgandassociates.com. So thank you for joining us. We'll see you soon.